I'm Leonard Jason, a community psychologist at DePaul University. Community coalitions can change power structures that perpetuate institutional ways of treating people. As an example, we release over 600,000 prisoners each year back to the community, and many have substance use disorders. Upon release, they face desperate living situations and their untreated addictions. This is not acceptable in a civilized society. Grassroots movements can help people in recovery integrate back into safe and supportive communities with low-cost housing options. Providing housing and job support is critical in helping them regain the skills and foundation needed to lead productive lives. In the U.S. population, alcohol and substance use disorders affect approximately 22 million people, or 9% of our population. For many with substance use disorders, treatment begins in a detoxification program. A time-limited therapeutic program will typically follow. However, these programs are becoming briefer as funding has decreased. For many people with addictions, detoxification does not lead to sustained recovery. Instead, these individuals repeatedly cycle through service delivery systems. The missing element for many patients is a supportive, cohesive setting following treatment for substance use disorders. Oxford House is the largest network of recovery homes in the country, serving over 10,000 people. They provide affordable and safe housing for people recovering from substance use disorders. This self-help organization has grown over the last 3 decades from one Oxford House to over 1,500 today. Residences are rented, single-family homes for 6 to 12 people. They are completely self-governed with no professional staff. In 1991, I saw Paul Malloy on CBS's 60 Minutes talking about this unique creation. My intuition was that I should call him, although I'd never done anything like this before. I called Paul and said I was a community psychologist and wondered if anyone had done any evaluations of Oxford houses, and said I would be willing to work with him. Out of the initial conversation grew a long-term collaborative partnership between a university-based research team and a grassroots community-based organization. Oxford House representatives and my research team spent the year getting to know each other. Oxford House members helped us fashion and adapt our interview questions. With the support of Paul Malloy, we recruited 150 people who were finishing addiction treatment at an alcohol and other drug use treatment facility in Illinois. Half the participants were assigned to live in an Oxford House, and the other half received standard traditional aftercare services. We interviewed each participant every 6 months over 2 years. We found that participants assigned to a communal living Oxford House had less substance use. 69% of those who had lived in an Oxford House were abstinent 2 years later, in contrast to 35% who were in traditional aftercare. We also found that those in the Oxford House were less likely to commit a crime. Only 3% of those in the Oxford Houses were incarcerated versus 9% in the usual aftercare. Finally, we found that the 2-year follow-up, those living in an Oxford House had higher incomes than those in the traditional aftercare. Monthly incomes for those in the Oxford House were $989 versus $440 for those in the usual aftercare. These findings suggest that there are significant public policy benefits for these types of lower-cost, non-medical, community-based care options for individuals with alcohol and other drug problems. These findings were subsequently used to influence both judicial decisions as well as state-level policies. So how can we expand these types of effective programs in the community? One way was to implement an intervention involving a $4,000 loan program and a recruiter to open up new houses. To explore this, we used a multiple baseline design to chart the expansion of Oxford houses in different states. The horizontal line indicates years, and the vertical line refers to number of houses. Very few Oxford houses were established during the years before the start of the intervention. We then introduced an intervention, as indicated by the vertical dotted line at the top of the figure, in one group of states, and a few years later introduced the same intervention in a second group of states, indicated by the vertical dotted line at the bottom of the figure. As states instituted the intervention, the number of houses expanded considerably. Community coalitions can be mobilized to transform many of the most serious problems that affect our society. These types of interventions can revolutionize how we treat our most vulnerable citizens.